Clinical vignette: decreased stroke volume due to systolic dysfunction, failing pump. A 65-year-old man with a history of hypertension, diabetes, and coronary artery disease presents to the emergency department with progressive shortness of breath, fatigue, and swelling in his lower extremities over the past 2 weeks. He reports orthopnea and paroxysmal nocturnal dyspnea. On physical examination, his blood pressure is 110 70 mmHg, heart rate is 95 BPM, and respiratory rate is 22 breaths per minute. Jugular venous distension is present, and lung auscultation reveals bilateral crackles at the lung bases. Cardiac examination reveals an S3 gallop. An echocardiogram shows a left ventricular ejection fraction, LVEF, of 30% with global hypokinesis. Question: which of the following best explains this patient's reduced stroke volume? A. Decreased preload. B. Increased afterload. C. Impaired myocardial contractility. D. Decreased systemic vascular resistance. Correct answer: C. Impaired myocardial contractility. Explanation: this patient has symptoms consistent with heart failure with reduced ejection fraction, HFrEF, due to systolic dysfunction. In systolic heart failure, the stroke volume decreases due to impaired myocardial contractility, leading to inadequate cardiac output and congestion. The hallmark of systolic dysfunction is a reduced ejection fraction, EF 40%, as seen on echocardiography. Why not A, decreased preload? While preload, end-diastolic volume, can affect stroke volume, this patient has signs of fluid overload, JVD crackles edema, which suggests increased preload, not decreased. Why not B, increased afterload? Increased afterload, e.g. hypertension, aortic stenosis, can contribute to heart failure progression, but is not the primary mechanism in this case, as the primary issue is weak myocardial contraction. Why not D, decreased systemic vascular resistance? A failing heart typically has increased systemic vascular resistance due to compensatory vasoconstriction, not decreased resistance. Key concept: systolic heart failure leads to decreased stroke volume due to impaired contractility, resulting in low cardiac output and volume overload symptoms. Treatment includes ACE inhibitors, beta blockers, diuretics, and aldosterone antagonists to improve symptoms and reduce mortality. Would you like a